Every year, cancer takes more than 1.9 million lives across Europe. But behind this number are lives that could have been saved, if diagnosed earlier.
It's very sad when you're seeing the patient with the advanced stage and who is quite young, and you know that you are unable to help him.
Their situation might have been different if cancer had been detected earlier.
And that's where the EUCanScreen project begins. It is a 4-year European Union-wide initiative coordinated by the University of Latvia. Its mission is to reduce the burden of cancer across all EU member states.
This is very, very important for any program.
The project aims to improve data collection and comparability. From technology to training, from governance to guidelines, EUCanScreen unites experts and institutions, bringing together 29 countries.
It was important to plan the project for each and every European country to benefit of.
Unfortunately, the majority of the cases are diagnosed at the advanced stages, where the treatment options are limited and survival rates diminish significantly. The treatment for the metastatic colorectal cancer is much more expensive, making direct impact on healthcare system.
Despite years of progress, cancer screening programs differ widely across Europe. Some countries offer well-organized, high-quality screening, while others struggle with incomplete data, low participation, and unequal access.
This is one of the reasons that this project is so important. It's how this project can standardize and can bring the countries that are lagging a little bit behind, in a better place with better performance indicators.
That's the whole idea behind the project, to bring all the countries together so that countries that are struggling currently with their existing programs can learn from the countries that have organized that in a different manner and have experience in how to do it well.
We do not expect that within this period the screening programs in each and every of the EU countries would be perfect. So for that reason, we are considering very importantly the sustainability aspect.
Sustainability is enabling this process to be continuous in time, so that it is not just one action within one project. We do set the framework for the new screening program, we implement it, and then when the project stops, the screening stops. So we need to have the continuation of the screening process. We need to bring the same people again and again at the regular screening intervals.
By implementing cost-effective screening programs for breast, cervical, and colorectal cancers, and preparing for newer ones like lung, prostate, and gastric, the project strengthens national systems while building EU-wide resilience.
Right now, if we get an early detection of the cancer, if you get an early screening actually, nobody is dying. For instance, I had myself oncology 30 years ago. So I'm still here.
I think it's unique that we have so many countries together and from every layer. So not just the people that organize the screening, but also the health policy makers, the ministries. And there, I think with all of those people together in one room like we have now, that can really change.
Screening programs are expected to be changing in the future. Programs might be becoming individualized based on the results of the previous screening test, characteristics of the person, and maybe even genetics.
It's a human, social, and economic challenge for us. Of course, we should invest. To get a quality screening, it means you should have an allocated, sustainable funding. And here is the role of policymakers and of politicians in EU. We have a lot of expertise who had enough experience in Latvia and abroad, in EU and even outside of EU. We are ready to beat cancer.
Early detection not only saves lives, it reduces future costs and lifts pressure from hospitals. Together, we can reduce the burden of cancer in Europe and give millions a better chance at life.